Okay, so good morning. It is Friday, May 9th, a really beautiful, bright and cheery day out there. What are we going to do? So this is Senate Health and Welfare and all the cheers in the room. We got to be happy about this. This morning we're looking at several bills, but the most important one right now is H91. Looking at our Vermont Homeless Emergency Assistance and our responsiveness to that transition to the housing program bill. I have a couple things I want to say. One, I know that people have been working outside of the room, and I know that there's a lot of this disagreement about one specific area, and that's the HOP. I get that. And the bill has a recommendation for moving the HOP in 28, which is some time out there. There are a lot of things that happened before that. And when all of those things are going on before that, the regional planning, should that continue to be in the bill, it is absolutely critical that everyone work together to improve the system overall. Without that, we're going to lose the funding that we have, that we're not going to see a welcoming administration, and we want to make sure that that happens. That's one message. The other message is to say thank you so much for everyone who's doing that work out there and working together to make change. We need change. We can't continue the way we are. So I will stop with that. I'm going to be leaving the room at 9:30 for a short period of time for committee of conference, and Senator Goulart will take over. By that time, we should have another person in the room, so that can happen. And thanks all for being here. And Commissioner Winters, thank you. So why don't you go right ahead?
Thank you, Madam Chair. Really appreciate that lead in. I do think that, there is something we all are agreeing on, is that the status quo is not good enough. We need some change, especially for the hotel motel program. And appreciate your optimism on this rainy morning. And we'll all keep smiling and working hard to try to get to a better place. And what I am doing this morning is proposing some changes that are made mostly in conjunction with the community action agencies. We've met multiple times and worked through some language that is mutually agreeable. There are a few places in here where they will not, I think, endorse the proposed changes that we're putting into recommending for this bill. But the vast majority of things are in agreement, and I'm sure folks from the sidelines will let you know which areas they might not agree with. What I do have is a draft with some marked up highlights that I could share, if that's okay with the chair.
Yes.
And walk you through in that way. I'll summarize some of the proposed changes. I'll go through that list quickly and give you a quick preview of the places where we have suggested some change to the bill. First, in the findings section, to include.
Do you want to put the bill up, or you want to just go
through? Could I do a
through?
very quick summary?
Yep,
And we'll
yep.
walk
That's
through
fine.
the bill. So this
That's
is,
fine.
and that'll take a little bit longer because it is a lengthy bill.
Okay.
There are multiple changes that we're recommending.
You got it.
First, in the findings section, to include some facts about the hotel motel program. Next is to remove the housing first approach. And we'll explain why we recommend that. The flag that we will have some suggested changes for definitions to be consistent with the housing and urban development language and requirements. We will highlight AHS representation at the regional advisory councils, just to ensure that there is AHS presence there and participation in addition to support. We would adjust some of the reauthorization language and the deauthorization approach, including an ability to engage and require corrective action in between those 3-year reauthorization periods. We have language requiring a reduction in hotel and motel use. That's not a specific percentage or a 1-for-1 trade. We discussed that at your last meeting. It's to set and follow annual goals for hotel reduction and shelter expansion, and include supportive and affordable housing units as part of those goals and expansion. The duties of the department, we have slight changes to how AHS is involved with I think the intent that you all have, which is to make sure that all agency resources are brought to bear on this problem. We would change the reporting requirements to quarterly from the very beginning and remove certain things that are readily available on an ongoing basis. So some refinement to what's in that reporting section. We would remove Regional Advisory Council from participation in that first October 1st report because they won't likely be up and running then. But they will be up and running for the next 2 reports. Combine eligibility and intake assessment sections, add a verification of residency, income, and homelessness to the January 15th report recommendations. And then there are several open questions still that I think, we all have to grapple with around the Community Action Agency budget. I think you're going to hear from them on that in a moment. The timing of the the January 15th, 26 budget plan and how that fits into budgeting for that year. Because a lot of budget planning for FY27 will already be underway. I think we all know that the budget is a big issue for the administration and for everyone. And so we can't exceed the historical amounts we've been spending in the GA program. I think we have to pay close attention, and you mentioned it in the beginning, Senator, to when the HOP transfer occurs. Further detail on the DA section and their responsibilities. I think there are maybe some changes that could be made there that we haven't fully fleshed out yet. And then, of course, I know there's conversation about using some funding from the General Assistance Emergency Program underspend this fiscal year. And I'm prepared to talk to you today about how that funding has already been allocated to other shelter projects, so you can understand where that money is intended to go at this point in time. And then be explicit that the intent is for spending on GA to go down as spending for shelters and supportive housing goes up. Those are some of the big issues, and I'm happy to walk you through that proposed language now.
You have it?
Because
we don't have it on our webpage,
so I did not send it, Madam Chair. I could do that.
Okay.
I was planning to share. Would you like me to send it right now as well?
Sure. Yeah. Sometimes it's helpful to go through. Is it a marked up yellow?
It has the yellow marked up from your ledge council, and I put the DCF changes in green so you could distinguish between the two. Could you please send that? No, thank you very much. Nellie saves the day.
Yeah.
She sees me fumbling with my email.
Good to have
Send the
somebody
documents at the same time.
behind your back. Uh-oh. This is what we have. Where is that phone? We do that on the Senate floor, Oh, terrific. Is that our yellow or yours green?
That is your yellow.
Okay.
Let me just get to the top of this.
The green.
Mine is green. So hopefully that helps clarify things a little bit, because you might not want all the green. We'll have a debate about it, a discussion about it. So this is the first part, of course, is the intent, the findings and intent sections. And as I mentioned, we would, the page numbers on this are not going to match up
That's okay.
necessarily with the page numbers that you all are used to, but this would add a couple of pieces to the findings section that talks about the GA program being originally intended as a temporary safety net, providing hotel rooms to Vermonters with emergency needs for a limited duration. And, I have seen a lot of nodding heads around the room when we talk about the original intent of the program and what it's turned into and how it's not serving Vermonters well. The second piece is the hotel motel program has expanded year after year, undergoing significant changes to eligibility and length of stay each year. And a bit about the cost. It will cost an estimated $40 million for fiscal year 2025 and has averaged more than $50 million per year since 2020. And also that the design of the statewide hotel motel program does not allow for effective delivery of services, wraparound supports, or engagement by service providers, nor does it consistently produce safe and healthy environments for the people it's designed to serve. Just pointing out some of the shortcomings with the hotel motel program and why we want to do something different. Under legislative intent, there is this section that states that Vermont's emergency housing statutes, rules, policies, procedures, and practices be modeled on housing first principles. There is the term modeled, so it does give some flexibility, but housing first is not really what this bill does. Housing first is not always what we try to do as a state. And that housing, and I wonder if I could defer to Director Sojourner a little bit to talk about housing first principles and why it doesn't exactly fit in this bill.
That would be helpful.
Thank you. For the record, Lily Sojourner, Director of the Office of Economic Opportunity. And we can send some additional information if folks are interested in learning more about housing first, which is a very effective approach, I think, especially when adequately kind of resourced and fully understood and funded. And, we're fortunate in Vermont to have some providers who do that really well. It is really, about getting folks into permanent housing as quickly as possible with the supports that they need. And it feels maybe a little incongruous at times with this focus of this bill being so much more on emergency shelter. And then I think there are other dynamics that raise questions just in terms of the fact that there are elements of this bill that do try to prioritize limited resources or do try to build in requirements for service expectations in a way that may not align with housing first principles. And so I think it's a discussion maybe that should be had to think about, does it fit or not? And if it is really an intent, what then would align with that intent? And again, we can send some documents if folks want to learn more about it.
Thank you. And this next section, I'll just flag it at the yellow language here that talks about GA transferring beginning in fiscal year 27 and HOP transferring in fiscal year 28. Again, that's a decision point that a lot of people have raised questions about.
I know.
We're okay with it as it is,
Yeah.
but just as we walk through, it's another kind of decision.
And if I may, I think there's a question as well for us of, does that become a conditional decision point as opposed to a automatic decision point? And if that worth considering, that if certain things are met or resolved, that would be explored, and if not.
So some transition language or something.
Maybe a check-in before that transfer happens.
Okay. That, I think that's kind of implied, but I think it's very important from what I'm hearing.
Thank you very much, Madam Chair. So, what would your opinion be on putting a study in here?
Yeah, I think, I don't think we would oppose that. I think it might make some sense to have some sort of a check-in before that happens. So we'll report back to the legislature on, is the GA program going well? How are the other providers doing? I think there could be some things in there worth looking at before we commit to this in 2028.
Thank you.
I think that probably will help take the temperature down a little bit. Big deal for people, like an understanding why.
So going back down through it, so here are a couple of definitions that we flagged that are not consistent with HUD's definition of homelessness or at risk of homelessness. So we can report back on those, or we can take them out. I don't know exactly, kind of defer to Katie whether that really messes up the rest of the bill if we don't have a definition of these two things, but they're not consistent with HUD's definitions.
Okay. What page is that? Oh, our page.
Yeah, your pages will be different. It's in the very beginning definitions section under 2203.
And if I may,
Okay.
and we worked closely with Ledge Council. I think one of the challenges is that some of the definitions are quite lengthy and very technical, which does not necessarily fit for a document like this. And so I think one of the things that we might like to at least raise is that, and the commissioner will talk about this later on, having the intake and assessment process be one of the things that's reported back on in October. And I think that's where maybe, as long as folks feel like this is in alignment with the bill, that those definitions could maybe even be further defined at that time, or again, further in potential rulemaking. As long as people understood that there might be some additional nuance. We just wanted to raise that for awareness.
Moving on, under the Regional Advisory Council, section 2204. There's all the language that you've seen before. And then here's where I mentioned that, the Regional Advisory Council should have the legal and technical support of the department, but we did want to make sure that we called out specifically that the Agency of Human Services and departmental representation will be at those meetings as needed. So, if you want table, DMH, any of the Agency of Human Services support should be there if it's needed for those regional meetings.
So, and when that happens, one of the things that I would be concerned about is anyone who's representing the agency from whatever department would have the ability, decision-making authority on that. So that's something to think about, because what happens sometimes is people have to go back and look at somebody else, talk to somebody.
I'm going to say this in duck, but I would anticipate that Director Sojourner will be at many of these meetings. Yeah, she's very well versed on this.
Okay. That's all we need to do.
Thank you. Commissioner Lyons, can we also add a safeguarding homelessness organization to this? I think I have it.
Okay, well, let's hold that one, put it down, and we'll come back to it as we go through the bill ourselves. Yeah, I've heard that one before.
Moving down to the section on establishment of EHAR. Reading is here. All right, nothing in that section. The authorization and reauthorization process for the community action agencies. We have some suggestions here. So this is not less than every 3 years, the department conducts a reauthorization review of each CAA, providing the services under the chapter. If the organization no longer meets the requirements of subsection B of this section, and here's where we tweak the language a little bit, or has failed to, and what it did say, meet the needs of households in its region that are homeless or at risk of homelessness. And obviously this is a huge task, and they will never meet every need of the households in its region. So we didn't want to just say it that way. So we added a little bit of language to adequately meet the needs within the constraints of the budget and other resources provided. So they're going to do as much as they can within what they have provided to them, but they're not considered failing for the purposes of a reauthorization review if they're not meeting every need of every person experiencing homelessness in the region. And this talks a little clarifying language on instead of saying remedial assistance, saying appropriate corrective action measures identified by the department, and failure to achieve compliance may lead the department to not reauthorize the community action agency. And then that language I mentioned earlier that, these are every 3-year reviews. This section does not prohibit the department from reviewing CAA performance in between reauthorization periods or requiring corrective action measures to ensure duties under this chapter are consistently being met. And that's something that, with HOP grants, we're kind of constantly monitoring, providing technical assistance and perhaps even requiring some corrective action if we see that what's laid out in statute is. And that's one that, that last piece did not have a chance to talk to the community action agencies about, and be open to their suggestions on what that language should look like. I guess I flagged the words of this next piece are the services provided under VHAR. And I just flagged the word may there, and then, we're going to look at whether that should be a may or a shall on the intake process and the requirement to have regional intake shelters. And there's a lot of support for that idea so far. Just tweak the language a little bit here. Instead of saying referrals to other services and supports, to use navigation. I think that's some of the language that we use in other settings that infers a little bit more than just, here's a contact or here's a phone number, but providing more assistance to get to other services and supports. Just flagging here the question about, I'm not sure, I don't know if anyone else who was there when this was discussed on the House side, but one of the services is advocacy. Just not sure what that is intended to mean here for a community action agency to provide advocacy services.
And also, if I may, Commissioner, for those three above, advocacy, and especially I just wanted to flag the connection there between the language that I believe was added around the designated agencies below, that for some of these, making sure it's a shared understanding, or clarifying if it is a shared understanding that, for instance, some of this treatment is not necessarily the sole responsibility of the community action agencies, but again, really relying on that system. And so again, when we get to that section lower, potentially either looking at the language here or there around that shared responsibility.
Got it.
And this really, again, targeted in relation to their individual housing plan and not necessarily broad expectations, for instance, around employment goals, if that's not a barrier to their housing.
Advocacy is what we have to do. They set up advocate below it.
Right. Right. We'll hear from Paul Dragon and from Jamie.
There's concerns about it.
Yeah.
By right silence.
Yeah, we don't want to, freedom of speech is important.
Well, people still advocate for them regardless of whether that word's in there or not.
Well, but you don't want to put them in a position of fear.
Being told we took it out,
Yeah.
if we do something, we therefore are sued to be done.
Well, we'll move along, but that's so understood. This is a discussion point.
Yeah, and I'll just say we don't have strong opinions.
Okay.
Just make sure it's just not
What it really is. Under use of hotel and motel rooms, so there's that language that's already in there about decreasing reliance on hotel and motel rooms, and of course, that's something that's very important to the administration. And that annually, as the shelter capacity increases, that the use in hotel and motel rooms would decrease. We had a brief discussion about kind of is that a one-to-one, is that a same percentage? And it's really not. It's kind of repurposing that funding towards something else, and you might not create the exact same number of beds or capacity. And putting in some goals. So annually, as part of the department's budget presentation, the department will set goals, for increases in shelter beds, and added this language of other housing, such as permanent supportive housing and permanent affordable housing units. So how is that increasing in each region, and how can that possibly impact less use of hotel and motel? Along with the decreases in the use of hotel and motel rooms, and incorporate those goals into regional planning.
So I'm going to ask a question that I think I'm going to need help with going forward. And that is, right now, we have a specific amount of money in the budget, and we've had it there every year. This year, $30 million plus this, and we've asked for the 10 here, this budget coming up. And we do get quarterly reports on what's going on from DCF. I'm what would be helpful to me, and you're gonna really like this one. I'd like to know what our, and have an expenditure analysis or looking at how the money has been spent over time since 2020. I know a lot of it was ARPA then. But how specifically was this year's money spent, the 25 year? Where did it go? How much went for services? How much went for administrative costs? How much went for shelters? What did this money go for? And have that looking forward for how the 26 money is going to be utilized. I guess my question is, I understand that to me, it sounds like a lot of work, but I'm thinking that might be, that accounting might be available to us. That I think we should know that. It will help me at least make decisions going forward.
So may I give a few broad strokes right now, Senator, if
Please,
that's
yeah.
helpful. So it's 38.5 million
Yeah.
in the governor's recommend. So I think it's around 30 million in the budget in one time and another 7.5 in base. And so of that roughly 38 million, the breakdown.
That doesn't count HOP or the
That doesn't count.
3.35 that we put in, right?
That's just the PA emergency
Yeah.
housing. And within that, we spend 2.9 million for the call center for the vendor.
Alright, so,
RBI.
no, I get that you can give me this,
Oh,
but I would not right
That's not
now.
what-
I'm just
Okay.
saying. Somewhere in this bill, I'd like to have that,
Oh.
to get that report back. And how the money
got it.
is used. And then we'll be able to sort out what we need to do when we're down the hall.
Okay.
And the decisions that we make here, that's important.
Yeah.
Because if we're gonna reduce the amount. You know, catch 22.
Yeah, yeah.
We've got people,
That's right. That's right.
Yeah.
Okay, just to make sure that everybody, I know you understand, but make sure everybody understands, we've got about 2.9 for the call center, 2.9 for our limited service staff,
right,
and about 32.5 million that we spend on hotels themselves. We also, there are other things. We have three
I know.
permanent positions that do
Yeah.
other things in addition to the GA. And some administrative costs that pays for 211 as well. All right.
I need to leave to go to conference committee. But I've asked one of my questions and I've got others, so. I'll be back. That's all yours.
Okay, we shall continue.
Moving on.
Thank you very
Thank you.
much.
Further in the hotel section, if a hotel or motel is being utilized, we've added some language about how the community action agency uses those. One section, this section says that the CAA shall enter into agreements for the use of blocks of hotel and motel rooms and negotiate the conditions for use of those blocks. And we added including placement of households to increase access for providers of case management and other support services to the populations they serve. And part of this just is a strategy that we have employed some and would like to try to use more, which is placing some like populations together so we can more easily deliver services. So we have a hotel that's dedicated to families, for instance. We've done that in a few instances. Maybe there are, if you can group a number of people who need access to medical care, in a hotel that's close to a hospital, some of those strategies. So this is kind of a nod to that strategy within the program. The next section is the under the VHARTH duties of the department. We just modified the language a little bit here from oversight from say the department and the Agency of Human Services have statewide responsibility. The agency itself is not going to be intimately involved, but I think this is, the intent of the committee and of the bill is to make sure that AHS is bringing all of its resources together on this. So the other departments and it's definitely involved in something. Now there are changes to this next section. Part of the duties is to develop and maintain standards for the operation of community-based shelters, and thought it made sense to also say here and provision of all the community hearth services. Down. Under reporting requirements, we are suggesting that, of course, this is open for discussion, but instead of every month that we report every quarter to the House Committee on Human Services.
Meeting.
Welcome back.
We're meeting at 10.
So under reporting requirements, we would suggest that we do this every third month. A lot of this data is not going to change month to month.
May I?
Julie Sojourner.
Thank you. Yes, do we meet every fourth month? Just trying to think of the way that things work. So if they're reporting July 1, September 30th, a quarter, it'll be the fourth month. Sorry about that.
No,
That would make it 3 times a year.
they're
No, because
4 months every 3 months. One reporting the year, so you need to report every 3 months.
I think we would, right, I think we want quarterly
Quarterly is what we would like.
instead of, so maybe, yeah. Instead of monthly, I think we would like to just quarterly reports.
Quarterly is on record. How we do with that. There was some language in here that I think is might be left over from some previous reports, which is, it's important information, but I'm not sure that it belongs here. The outlook for transitioning additional households to permanent housing in the coming months. That's not one of them, but that one I think is going to be difficult to forecast and report. I defer to some other folks in this room. That's, you know, how do you put into a report the outlook for transitioning additional households to permanent housing in the coming months, including an estimate of the number of households likely to be placed per month. I don't know if we like every quarter want to try to set those goals through this. That just seems a little bit difficult. And then these other pieces are related to, this is information that the Agency of Commerce and Community Development would have. They look at this all the time. We run into it as well, but that's something that can be provided at any time, but I don't think would change from report to report very much. What are the local regs and ordinances that are impeding timely development? Something we're happy to report on and, you know, bring Commissioner Farrell in to talk about. But I'm not sure that it fits within this kind of.
Why wouldn't it fit here? I'm trying to sort that out.
Yeah, it's definitely related. So every quarter you want us to report, or every month actually is what the bill says. Every month report on what regs we're running into, local and state rules and regs that we're running into that are impeding development of affordable housing. I guess it's an ACCD thing. So if you get after that in here, we would be tapping their resources to do that.
Thank you, Chair. A few things. I kind of like the beginnings that outlook language only because I think it sort of sets a North Star. It sets, like what we should be aiming for. And it may be somewhat aspirational, but if we don't have that, we don't want to be complacent. And I think this kind of holds us accountable. And then that second piece, we just saw an affordable housing project go down in one of our communities just recently. And this is another way to kind of keep that conversation alive and hold communities responsible to their part in all of this. So I kind of like both of these two sections, but we, obviously we can work on language, but
No, that helps me understand where it's coming from.
So the concern actually that you're sharing is the frequency with which you'd have to produce this information?
Yeah, that's part of it. I think a lot of it wouldn't
Yeah.
change very much once.
Yeah, okay, and think about it, a timing issue. Getting you a copy of this.
And if I may, I think the frequency is then associated with like administrative costs, and even some of these would require, I think, either investments in IT or staffing. And so with some of this level of detail, it would again, just have kind of a base impact for the department as well as for the agencies, but then if it's also being done at a higher frequency, it's taking
So, Yeah.
more staff time to review it.
some of the thinking, I think, is it's really important to have municipalities linked into this, so we mentioned that earlier on. And then having this information that can influence this municipality, somewhere it goes in, some may not fit right here, but somehow along thing.
And just
Yep.
as the Director Sojourner just said, like, a lot of this is going to come from the community action agencies, so it's going to be quite a task to pull it together
Got it.
from all 5 community action agencies to get it into a monthly report with quarter basis.
She's always right.
Maybe
If only.
annually your budget.
I may have missed something here, but this is it seems redundant after there is language above in 2204 about regional advisory councils. So I think perhaps this is not being in this section.
So we'll talk with Ledge Council about
Needed
this.
because
It
it
is.
has to be recodified in a different spot, because the previous one goes into effect July 1, 25, and a different codified under a different number, so it has to be recodified in 2026.
So
So uncross out.
Next is, so these are some of the community action agency sections. I might be confused. Well, we don't make any changes here, so I'll just go over to that. These are reporting requirements, and it did have, the monthly frequency shifts to a quarterly frequency in 2030, I believe, under this language. So if we're already starting out with quarterly frequency, then here's the implementation planning sections. As I mentioned, this is the first report, the October 1st report. And the regional advisory councils, in the October 1st planning, will set out the structure and the framework for the regional advisory councils. So they really wouldn't be in existence yet at that point. So we would suggest removing them from the October 1st report as one of the collaborators. That's the October 1st report. And then there are a number of things that are in that October 1st report. And we just tweaked the language a little bit here around eligibility, determining need, prioritization. So we removed the eligibility and folded it into the number 5 below. We included, and this has been kind of a debate between DCF and Community Action Agency, kind of debate, a discussion so far on those extreme weather shelters, and whether those should remain kind of a statewide responsibility or folded into part of the responsibilities for the community action agencies as part of the Hearth. I think there are pros and cons either way to doing that. There's funding that would have to, go along with that. Some community action agencies are familiar with running extreme weather shelters, others are not. So we just wanted to add in here that it's starting now as a DCF responsibility. It is named in this bill as a community action agency responsibility eventually in 27, fiscal year 27. So we wanted to build into the October 1st report a more robust discussion of that and a recommendation on whether it should be statewide or whether it should be regional, which is more effective. And I think the community action agencies are more comfortable with that than just having to transfer to them. as the bill grows.
I just don't want to overtax the local
Right.
organization.
Organizations, things that.
Yeah.
We'll have a recommendation back to you on that.
Okay, good.
Subsection 5 here are recommendations for, I mean, very important that we lay out what the core services are. What are the requirements for intake and assessment processes? And how we determine need and prioritization for each type of shelter that a household might utilize, including intake shelters, as well as a timeline for implementation of each service in the first quarter of state fiscal year 2027. So I think it's important to have that conversation right up front with the community action agencies, what we believe that the core services should be, how does intake work, how do we determine need and prioritization of assistance, and what are those intake shelters like, and laying out the time. So in October, hopefully we'll have a really good sense of a framework of how this could roll out. That's all part of the October 1st report. By putting core services up above, we think this subsection 3 is no longer necessary. It's covered. We would modify the language about 211 slightly. It kind of assumes expanded use of 211. And sorry, I missed some green there. We added the words "the role" of 211 instead of expanded use of 211.
Okay. I thought the word "of" was missing in there.
Subsection 6, whether access to all or some services, including shelters, added a little clarifying language, should include an expectation regarding household participation in case management services. So that's another recommendation that you'll see in the October report. And then here's a section again that I've highlighted a couple of times in that report, whether to include verification of residency, income, or homelessness as part of the intake process.
So this is gonna be a report in October
That's right.
on that.
There
So
will be a very
essentially
healthy debate
saying,
about that.
okay, residency is still up in the air.
Yes.
Or where people have come from, where they live. Okay.
Correct.
I know that there are some homeless people who are using the state of Vermont hotel and motel program to their advantage from out of state. I do know that. But we want to make sure that we're not catching people who might need to be in the state of Vermont in both directions. So, yeah. Okay.
This next section is about the other implementation planning reports. One on January 15th, which is a comprehensive progress report, including estimated fiscal year 2027 budget needs, and did flag that the governor's budget process will be well underway and pretty much and would be finalized at that point, I think. So this would make it for a tricky, like, is it a budget adjustment act? Is it a part of the state budget? The timing here is just something for folks to grapple with.
It's
It's
challenging.
Yeah.
Very challenging.
And then there's the April 1st, 2026 report, which, I think I see as somewhat of a like go, no go at this point, how we get this comprehensive report detailing the results of all the regional assessments and an implementation plan. And the language here to say which shall not exceed the budgetary estimates provided in the progress report. So that progress report in January, and then what's it look like by April 1st?
I mean, it does open up the question about timing again and timeline. So we'll have to hear from folks about January 15th. Can it be earlier? Is there something we can do? Through the BAA or, some recommendations during the budget process. I don't know. Wow. Right. Do you have something?
No, me, I was just wondering what you meant like go, no go. You mean like we keep it or we don't keep it?
Yeah, I think April 1st, you'll see here's the plan, here's the budget, here's what we can do.
Okay. Got it.
We will hopefully have a well-developed plan and ready to execute on July 1st.
If we could, oh, we do have on or before for January, that's good. Anything we get earlier is gonna be so good.
This next section is about the designated agencies. Committee added. We appreciate that. We might have a little bit more, we haven't been able to finalize it, but a little more language about the responsibilities of the designated agency with respect to the hearth. Quite specific.
So I know, and so some of this language, going through all of this, it really does suggest there may be a reduction in the cost of the programs overall, but it will definitely be a shifting of resources, and this is one of the places.
Yeah, I think that's a good way to look at it.
Okay.
Just breathe. Deep breaths, deep breath. This is the community action agencies section. We still kind of looking closely at this to make sure that it aligns with the hearth. Might have a few more changes to this, but I don't have anything for it right now. And I know time's running out. Kelly, is there anything you wanted to add about this section? This is your world.
Yeah, I think, for both this and the designated agency section, does it make sense to either put something here, or is it more just kind of clarifying responsibilities above in the VHART section so that we're not inadvertently maybe conflating other responsibilities that they have or
Right.
but do we need to maybe above for the community action agencies, or potentially add in more clarity around designated agencies in the kind of main section of the VHART bill, just for some further responsibilities and perhaps further responsibilities for the department as well in terms of our role and oversight and other areas.
Coming around the final third here, we've got the appropriations section. Not recommending specific change here, but just flagging the 6.5 million that you can hear from community action agencies and more nuanced approach to that. And also the 3 million that's in here for continued development of shelter capacity. Just flagging that there is 2 million in the budget and the appropriations bill in the governor's proposed for development of shelter capacity as well.
So I have two thoughts in the budget, and I don't know, we're going to hear from folks about the budget recommendations. Actually, three thoughts. One, we've got a transition period that will require slightly less funding, so we may be able to attenuate the problems some people see with budget. But then there are a couple other things that come to mind. One is the Bridges to Health is a critically important program for people, for medical care. And one of the things we have in the bill is linking up with medical assistance. We're thinking that I'd like to see some language, and I'm going to ask Pledge Council for this, some language on how to include Bridges to Health and within the budget that's here for the next year. And so to add in that support, the healthcare support that many people in poverty need. So that's one. And then the other one is thinking about all of the emails I'm getting from my municipal constituents and the pressures that are being put on municipalities for public safety or other services. So maybe not a designated appropriation here, but some language that provides grant something to help a working relationship with municipalities to help. That's my other thought in the budget area. So, but the bridges, I think, is really very important.
If I may, just for the 3 million, I think also, as we've looked through and continue to look for a suggestion there to have that not just be the development of shelter capacity, but also supportive housing options and services.
Got it.
So again, seeing that as you reduce the need for the general assistance hotel program, folks may be going into shelters, but they may also be, and hopefully are going into permanent housing, but then need that supportive housing services. And I think in some ways that speaks to, your comment too, of making sure that folks get the services that they need so that they're not potentially, popping up in other ways from municipalities.
Exactly. We don't want them showing up on the street again. And we don't want them in the emergency department. So we're gonna have to sort that out. Okay,
And then there's the future appropriations section. And again, just flag that the bill as drafted talks about equivalent funds and resources to those used based on one time in fiscal year 2025. Just note that for fiscal year 2026, the spend is around 40 million. The 2025 spend, we estimated, I think around 47 million. Anticipating that we'd have about 1,800 hotel rooms, and a number of them did drop out of the program. So we only used about 1,500 hotel rooms for the year. So we underspent. You were asking kind of about that GA surplus.
yes,
It's about $6.8 million is the surplus, but it is very much been using it towards
obligated.
to other shelter projects, and we can provide you an accounting of that.
I'm trying to remember if we have language in the budget that says that to do that when the money's left over to go ahead and.
It's a good question. I know we debated that.
Yeah, I'll have to look and see.
Yeah.
We can.
I think that is it. Thank you for entertaining this and considering these recommendations. We hope that'll make the bill better. Again, the vast majority were ones that were agreed upon with the community action agencies. So, yeah. I'm sorry. No, that's okay.
Just can I ask you a question?
Yes. I can provide you some of those non-homeless providers. Non-providers. I'm sorry.
Thank you. I just, maybe today's not the day to have this conversation, but the part where you spoke about sort of grouping folks with similar needs together, we have in Burlington, like Decker Towers, for example, and it seems like that doesn't always, it sounds like an efficient way of handling a situation, and yet we know through, lived experience and evidence that doesn't always work the way that we'd like it to. So I guess it's something I hope we can talk about some more.
Yeah.
How that would look like.
Yeah, I appreciate it. It's got to be a careful approach. In some instances where we're housing folks, you might have registered sex offenders, not many, it does happen. And so we would not want to place children in the same hotel. Or, domestic violence victims, or, so just being careful about, placing people together. Sometimes families was a good example where we have a few hotels where we group families together. And that's what,
So being thoughtful about placements and, yeah, okay. Thanks. Oh, gosh, all right.
Are you
Any other questions for Commissioner
But
Winter?
just quick question. So you're finished with presenting your
yes.
information?
Thank you.
Can I ask you then, in terms of the budget, then we'll hear from the CAPS? And then any specific, there may not be specific funds associated with budget. That would be helpful to get to the. And we'll come back to this.
Thank you.
This is not finished. So we'll bring, after we hear from CAPS and others, on the recommendations, then at some point we'll have our ledge council up and try and go through this and sort this out. And as we do that,
Not, but not today.
no, we won't have time to do that today. But our style in here is have everyone in the room and we'll sort it out and have the conversation on decision points. So we will do that. This is extremely helpful for me in particular. Okay,
Thank you.
you're in charge. Thank you.
Okay, I'm in charge. I have on my agenda that Paul Dragon will be next to speak. I actually don't, the other folks who are on the screen, I don't have on my agenda.
No, but I think Amy is just here for a Q&A.
Okay, thanks, Amy. Great. So Paul, you have the floor.
Okay, well, thank you all so much. For the record, Paul Dragon, and I am joined by our other CAP directors. Kind of made this on short notice. Maybe they can introduce themselves as they engage in this testimony. But thank you so much for having us here and for all your work on this really, really important bill. We appreciate it.
Paul, can you just try to make sure you're speaking into the microphone?
Yeah, I'll get closer. Thank you.
Great.
So because we're presenting on the budget, I think it's just important to kind of ground us here that today and every day for many decades, many people experiencing homelessness come into our community action offices for homeless services, including housing navigation, housing prevention, housing retention, access to shelter, and essential needs and services if they are unsheltered and living outside. They also get many other services that the CAPS offer by walking through one door. We're always happy to answer any questions about our holistic services. I just wanted to set that for the budget discussion and the timeline. So we're really invested and feel a deep sense of duty and responsibility for H91 in this process. We so appreciate our partners doing this work, and we value our partners at DCF and Commissioner Winters and that great testimony, walking us through H91, just doing great work alongside of us. And since we have found out about H91, we have worked really, really hard to clarify and provide feedback on a bill so that it works for our communities, our partners, and especially for people experiencing homelessness. We've had to do this fairly quickly, as you know. And before we go through the timeline and budget, we would love you to understand that there are many things we still don't know about the state infrastructure, what it takes to run the current system. And that's a kind of caveat for the budget that we're going to be proposing. Those often kind of unseen and interconnected mechanisms to provide what I think we can all agree is a complicated system and a needed system for people experiencing homelessness, and it is what they currently rely on. We hope that this system has evolved over many years, so our insight is limited, and our hope is to simplify it at the community level with a single stream of funding to eventually end homelessness through VHARP. Again, we see the possibilities of simplifying the current system in order to create a better future, and we've tried our best to see ahead and understand what this will take in this timeline and budget. So we do have a timeline that Amy's going to show, and Commissioner Winters was kind enough to talk about and walk through the legislation about what each of these benchmarks entail. So I won't do that. What we're doing is showing the timeline because it does connect to our budget, which we're going to show you in a moment. And just to kind of go through this somewhat quickly, we have this timeline, and from July 25 to 26, there's transition funding for the community action agencies. This does not include HOP. From July 25th to July 26th, we have DCF managing the hotel program. from October 1st, 2025. The DC, on October 1st, 2025, DCF and the CAPS are going to be developing a framework for VHART, which Commissioner Winters talked about. October 1st, 2025 to January 15th, 2026, another benchmark. We'll be doing regional needs assessments. On January 15th to April 1st, there'll be regional planning and a report to the legislature. OEO will continue to manage the HOP program from July 1, 2025 to July 2027. And July 2026 to April 27, we're going to have time for, continued regional planning for the HOP transition. In January 2027, DCF presents to the legislature in a budget presentation. And in July 2027, CAPS manage the VHART program. And Commissioner Winters talked about the conversation, which we're happy to engage in, about emergency cold weather shelters, which is, still up in the air. So that is the timeline, and we're going to show you our budget. And we do want to note that our budget, you saw in the bill, there was an allocation of 6.5, and I think a little over 400,000 of that is going to the network for our domestic and sexual violence shelters around the state to do similar work that we're doing. And so here is our budget. We are well under budget, by the way, you will notice. And I think Amy is going to try to show the budget.
Getting there.
Oh, sorry, that's okay. It's all good.
Got it.
Thank you so much. And again, with limited insight, we have put this together and tried our very best. First, you will see, and it's color coded by agency, and then we have it broken out into kind of similar and like positions. So first, you're going to see a statewide VHART director. This will support our statewide approach and help tie our CAPS together, kind of like the network has a team doing this work. We are asking for one person because the legislation does call for a statewide approach. So this person will help tie the 5 community action agencies together in this very important work, specifically on homelessness. And it will be connected, of course, to our broader anti-poverty efforts, which we bring to bear in all the work that we do. We each have a VHART director, and that was where the timeline comes in. We think we need to do this fairly quickly. You'll see CVOEO there, July 25th, because we've got to start working with our communities to get ready for that timeline that we just outlined in elements in that timeline that Commissioner Winters went through. As you know, there's 5 community action agencies with enormous geographies, right? They're covering the whole state. CVOEO, for instance, covers nearly a quarter of the state. So we want community engagement leads in our counties, not in every single county, but for the most part in each county. And we think that is important because these folks are going to do something like we've never had before in the state. And it's community development, it's community building. They're going to be outreach, all focused on ending homelessness. They're going to be outreaching to regional planning commissions, the United Way, the recovery centers, the FQHCs, Bridges to Health, which Senator Lyons mentioned. All this work, they are going to be going to meetings, developing plans, working on assessments to bring these systems together to bear in their particular counties, which is really, really important because each county, as you know, is quite different and faces different challenges. So each one of these positions, you'll see a director and a community engagement or community builder person. You'll see it for SEVCA, you see it there for Brock. And then we go to kind of what it takes to do this as an organization. This is like the hub piece of it. And of course, we're going to need fiscal managers. And we tried to get our terms all correct here, and we might have a little bit of work to do, but the total is the total, and the effort is the effort as we see it. Again, it's, we've worked really, really hard to be fiscally as conservative as possible on this. So we need fiscal managers to do financial support, to work with our partners. We're going to be preparing RFPs. We're going to be engaging in our communities and in the continuum of care and what the needs assessments say, and then what the proposals are, and all that work takes time. It takes managers, grant managers, and business folks to kind of work through that. So that's fiscal managers. We're going to need a little HR support as well. We are lean organizations. I think you know that. We are a very lean organization. So to take this on, we do need to develop our infrastructure a bit more. So around fiscal management, grants management, oversight of the grantees that we'll do in partnership with AHS. That work is really important. And Amy, I think you can continue to scroll down. Thank you. And of course, with this, we're going to be capturing a lot of data. As you know, one thing the community action agencies bring to this is really robust data. We have the national performance indicators that we report on quarterly. It's a massive document of data that we collect on our anti-poverty efforts. And we'll need our IT folks involved in this to really help work on the data management for this particular piece. The way to think about it is you've got your community needs assessment. What are the needs for the community? How do you plan? What are your outcomes? And then how do you report on it? So we do need that IT and data piece. And again, you'll just see like the work that has to be done in our financial systems. So that is a very brief overview. Our amount is about 4.5 million. We were allocated, if you take out the network, at about 6.1. And we think this is our best effort with limited insight into how the state puts this current system together to bring this into our community action agencies, into a statewide approach with some uniformity and consistency to really help change the system in Vermont and to make it community-based at the local community level. So that's what we have.
Paul, that's really impressive. Thank you so much for sharing that with us.
You're welcome.
Wow. Yes, Senator Cummings.
Paul, is that an ongoing annual budget?
Oh, Senator Cummings, that is a wonderful question. We do need that because think about, trying to hire folks, embedding them in the community, doing the needs assessment. This isn't a one-time thing that we need to do. We need these folks on. And I think the good thing about this is you're investing in the continued operations of each of the community action agencies and tying this together better as a system statewide, kind of like the network has for domestic and sexual violence shelters with a lot of resources. We're asking for one person there. And we are asking for some infrastructure in our community action agencies ongoing to keep this work going, because the work in the community will be renewed every 3 years through a community needs assessment. The planning will never stop. We're transitioning programs and trying to move people out of hotels, which is going to be very difficult with the limited amount of funding, the finite amount of funding there, as the commissioner said. So yes, this is, I think, as absolutely lean as we could go, and we need this every single year.
Yeah. Thank you very much. It's really, really helpful. And thank you to, I think, Amy put these together. These are really useful resources.
Senator, can I just add one thing to what Paul said?
Yes.
Amy Schollenberger, for the record, representing ECAP. I think this is the base budget, but as the CAPs take over more responsibilities, obviously they will need to add more staff. So it might go up, just to be clear about
Yeah, no, that was my thought. These are all central office people. If you're going to actually be out opening shelters, somebody's got to supervise shelters, somebody's got to stock shelters. That's not something your IT specialist is going to do. So there will be significantly more staff needed to do the job.
Yeah, I should have clarified if I didn't, and thank you, Amy, that this is really for the operations and planning piece initially.
Thank you. No, that's really helpful. And as a dreamer and an optimist, I want to envision a future world where we will invest in people, you know, from cradle to grave, and possibly as we get further, hopefully further away from the opioid crisis, and you know, we stabilize the world in a future place, that maybe we can start, you know, as we analyze the system, maybe there will be a time when we can start reducing the need for all of it. That would be my hope, and I'm sure the hope of everybody here. But I understand that in the short term, there will be a need for a lot of investment. So thank you very, very much. Did anyone have any other questions that they would like to ask? Anyone, did anyone on the screen want to add anything that was missed? All right, well, thank you so much. We had our legislative council next on the agenda, so we can ask her to come up. Thank you again.
Thank you. Thank you for having us.
Thank you.
Good morning. Good morning. Katie McDonough, it's a legislative council. Last time I was here, you asked for a chart of effective date timelines. Would it be helpful to start there?
Sure. Okay.
Oh, and I left the room. Game shut on me to rejoin.
You can ask that. Several people a little bit as to what to be doing right now.
Really, whatever the committee would like. So, well, whatever you would like. I thought we could look at this timeline, and hopefully that would provide some clarity as to the bill structure, if
Yeah.
that is helpful. If you'd like to go through the DCF draft and talk about, you're not ready to do that yet?
I think it seems like the chair should be here for that.
Sure.
Although
Okay.
it's,
Well,
because it's a lot,
let's see where we get after
Okay.
we get through this timeline.
but unless you want to. No. Okay.
Okay. We have that on the screen. So this is the draft 2.1 timeline. I know that we've already heard some comments and you've already kind of made some changes, but this is sort of a point in time, it's draft 2.1. So July 1, 2025, what takes effect? You have your regional advisory councils in effect July 1, 2025. And also you've appropriated the $10 million in transitional funding. I sent it to Senator Lyons, but I don't know if she preferred posting.
Because it seems like that with this is kind of it's a good,
Okay.
right, a good coupling of research information. So let me see if it's on.
Didn't look like it was on for today, but I did it a couple days ago, so I don't know if I posted it.
Thanks. Okay.
Okay, October 1st, this is the first of 2 reports by DCF on a variety of projects, weighing in by the regional advisory councils and others. Some of the topics include a process for the regional needs assessment that will be conducted, performance measures, so report back on what those performance measures will be, eligibility for VHEART services, and appropriate intake and assessment processes. That would all be part of the first report. On January 15th, we get the second of the two DCF reports. Which would include recommendations on, again, a variety of topics, including funding allocations between providers, expectations regarding participation case management, night limits for the use of a hotel or motel, if the agency decides to use hotels or motels, and financial participation. Also on January 15th, you'd get an initial needs assessment from the community action agencies. And this would include the estimated fiscal year 27 budget costs and administrative costs. On April 1st of next year, you get the second piece of the needs assessment from the community action agency, the final needs assessment. So this is their needs assessment, this is the implementation plan, and the language right now specifies that the estimates provided in January, what's coming back in April has to be within those estimates. And then VHART itself takes effect July 1, 26. As we've already discussed, it would only use funds previously designated for GA emergency housing. And then in January or February, so 6 months after VHART has been implemented, DCF would present a transition plan for the use of HOP funds in VHART as part of its budget presentation. And then July 127, VHART's transition continues with the addition of the HOP funds into the program. And in July 128, the monthly reporting becomes quarterly.
Thank you. This is really helpful. I'm assuming that folks think that this is doable since we are moving along with, and we've got this great budget now and everything, so that's hopeful.
Well, this budget is really the startup budget, right? And they spend, figure 2 years, $10 million, and we're gonna get 4 point something. But in order to do anything, you're not gonna get rid of these people, so you're gonna have to keep paying them. Plus, you're going to have to repurpose some, but you're gonna have to make investments. Somebody's gotta buy beds and things for shelters, find and set up a facility,
Facilities.
I think I saw anything in here. Maybe you can repurpose some people, but you're going to need people to do all the intake and assessment. And we haven't got the federal money coming in that we had during COVID to build housing. So I'm not anticipating having Barry, we've got the quality in that will become housing, but it's been used as a hotel housing. So that will become more permanent, but
So to Senator Cummings' point, so we see that there's transition funding for community action agencies. Is there anything, did I miss what's the next budgeting process after that?
So it would be whatever it's really this
January 5th.
language that's when you get the proposed budget from the community action agencies. And you heard testimony about the challenges of having a budget coming in that time of year, but you've also heard testimony about that might be the earliest date that it can be pulled together.
Yes, it's gonna be tricky. I see Amy's hand up. Go ahead, Amy.
Amy Schollenberger for VCAP. I just wanted to let you know that the CAP agencies are already thinking about that. But I think a lot of what they will need will depend on the October 1st agreements with DCF and the CAPs. And also whether you agree to what's brought back to you as these are the agreements that we have. And so it's not like they're only gonna start planning the budget then, it's just that it may need to get refined over time as they really understand what they're responsible for. For instance, are they responsible for emergency weather or will DCF keep that? You know, so I think you'll get some information before January, but it may be very tentative.
Okay, thank you. Great, it's helpful.
Yeah, because we are coming up with this $10 million out of. That's one time.
Right.
These are ongoing costs plus these may be the smallest of the costs because if you're gonna run a shelter, we've already had difficulty finding space for shelters, finding personnel for shelters. And this is without town resistance. At least around here, a lot of the downtowns that have the larger rooms for shelter space have gone underwater, and we've actually lost, I think, for a time, at least all of the church basements that were being.
So you're talking they literally went
They
underwater.
literally went underwater. Yeah.
I wasn't sure.
Literally.
Figured it.
No, literally, I don't know that the Methodist Church even has its wiring back in. I don't know if it was old knob and tube and chiseled through the granite blocks, but it's been a major undertaking. I know the Episcopal Church had to replace its church floor, and there are challenges with having the homeless within the church buildings. There have been incidences. And so, yeah, we're asking them to do a lot. And we aren't guaranteeing them the money to do it.
Right,
And that's concerning.
yeah. Okay, well, that's a good point. Further discussion on that, for sure. Did anyone have any questions on the timeline? Or anything else? Yeah. Is, so,
We've got many reports. I know we've got reports. We've got to pay somebody to write.
I mean, that's maybe a question for Michigan Winters and, you know, Sojourner. I don't know, where all these reports seem like they were necessary and vital to the success of the program.
I do think it's important to measure success as we go and have some of those check-ins. Because this is projecting a big change out for over several years. We would greatly appreciate going from a monthly report to a quarterly report.
Right. Yeah.
That would help a lot.
Yeah, somewhere in this timeline at the very end, you said it went from being monthly to quarterly. And that's the one you want to change. Yeah, monthly just. That's a full-time job.
That's a lot, yeah. And you mentioned that in your
I did.
remarks, right? Okay, great. And then Senator Cummings, you missed some of this?
Yes.
Yes.
Where was I? Was in the principals.
You were in the principal's office.
Earlier, I was in the superintendent's office.
Okay,
I have been very bad.
Whoa, all right. So, I mean, we do have about a half an hour. Would you like to go over some of the language that?
No, I think I came in, I saw most.
Okay, okay. Unless anyone has other things they would like to say, I'm thinking at the moment we could maybe take a break, but I do think Brenda Siegel might want to say something.
Yeah, Brenda Siegel and Homelessness Vermont. I have just a couple of things. One of them, I do want to address the putting like communities together. It's fine if it's families, but when we're talking about people with disabilities or medical needs. There's a huge disability rights issue and a very negative history in our state of asyluming or institutionalizing people and around the country, institutionalizing people in certain areas or siloing them away from other parts of the community. So while it might be helpful to have some of that community in one spot, I would still think there needs to be a mixed group of people. That's really important for disability rights. The other thing is, I think you caught on the statewide things. So I'll let you take that on. And then I really do want to address just quickly the idea of motel reduction. Not that we're against it, but we're really moving away from the GA program altogether by age 91. And so the shelter providers and CAPS may decide that the use of like a block of hotel rooms with services is programmatic. And I don't think we want to restrict that use because it might be the least expensive way to deliver the shelter. However, it would not be GA. Like H91 moves us away from GA altogether. And so I do want it.
Sorry, just to clarify,
Yeah.
is there language in here that prohibits what you're talking
I
about?
think I'm worried when we say reduction of the use of motel rooms as a goal, then if we take shelter providers might decide we are going to rent or contract a block of hotel rooms and use them as shelter with services in tax. So programmatically, and I don't think we want to restrict that. So I think we have to be careful. I think language needs to be carefully done.
Yeah.
In that way, because it is right now the least expensive way to deliver shelter because you don't have to build new shelter. And
But we could add language.
yeah, I think you could add language that protects that. And then I really want to adamantly support keeping the word advocacy. I think both advocacy for individuals and for households is part of the job of the CAPS. It's also part of the job of the providers. And it should be included here. It's critical, and as an organization, that's a big part of our mission.
Yeah, I think Senator Cummings said it very, very well
Yeah.
earlier. Yeah. Yeah.
The last thing I wrote number 3 needs to stay, but I don't know what that means right now. So
Right. I
get that
made note of it on my.
Okay, and then
That's what I'm sorry.
and I just wanted to answer your question about Vermonters versus non-Vermonters. In our data, which is actually coming out soon. I had it in my hand the other day just to prove it. It is, we found that 4% of all people that we interviewed over 200 people in 10 towns, that they came from out of state. And of that 4%, that was 8 people. So 5 of them came either fleeing domestic violence, here for a job, here to move in with family, and it fell apart, here because they had an apartment and it fell apart. So it's really important to note that, but also that 4% matched exactly the AHS data for that year. So that was so it was match that. So I just wanted, when we're thinking about residency, we have to think about a lot of factors that come in terms of why people are coming here.
Yeah.
So that is universally been true. And in fact, across the country, when you look at data, people don't tend to move to different states for benefits, but every single state has the belief that people are moving here for their benefit.
Yeah.
So it's just something to keep in mind when you're looking at like research on this issue.
Thank you. The only other thing I want to say is in terms of the grouping that you started with, I hope there is language that we can come up with that sort of gets to what Commissioner Winters was talking about, being thoughtful about families and so on, and also not going down a path that leads to something that we will regret later on. So I hope we can come up with language there.
I would be happy to agree to some.
Okay.
It would great.
Does that sound good, Commissioner Winters?
Yeah, absolutely. I appreciate the concerns that the Siegel has raised. And it's for us, I think it's about effective delivery of services. But also the grouping, the kind of the group home approach is something that don't want to get on that.
Okay, super. Thanks, everybody. That's been really helpful. Any other questions?